Ladies and gentlemen, the big question this evening on Urban Debate. Is it time for you and me to mask up again? In Kerala and Karnataka, the answer to that question is yes. In Singapore again, the answer to that question is a big yes. Today, the government of India has issued an advisory over a new COVID variant called the JN.1. Now, this subvariant was first identified in Luxembourg and is the one spreading in China, the United States, and even Singapore. The new variant was first detected on December 8th after a 79-year-old woman tested COVID positive in Kerala. This was the first in India. The woman has since recovered, but the concerns remain. The state has now asked all senior citizens to mask up. In fact, today, neighboring Karnataka has done the same. More importantly, the centre has issued an advisory to all states asking them to monitor and report all influenza-like illness cases.
So far, the last 3 months, we have had one death due to COVID, but also they had other comorbidities. So the person who died had a lot of other issues, but also he had COVID. So that is one thing. But otherwise, we have already, taking precautionary measures. We have told to increase testing in all the hospitals and health centers. Who was coming with the symptoms of cough and flu and other COVID-like symptoms.
Just to tell you that India has recorded 335 fresh COVID-19 cases and 5 deaths today. 4 of those deaths have been reported from Kerala and 1 from Uttar Pradesh. Question is, as cases surge around the world, should you be worried? I'm putting that question to Dr. Issac Bogoch, who's an infectious disease physician and scientist joining us from London this evening. Dr. Issac, thank you very much for your time here on Mirror Now. First things first, we have one case in Kerala, a South Indian state, where the new variant has been detected. The woman who was infected was an elderly lady. She has since recovered. I want to ask you if there is anything for us here in India and the rest of the world to be worried about. More importantly, should we be masking up?
That's a great question. I think let's take a step back and remember that the JN.1 is under the umbrella of Omicron, and we've been in the Omicron era for almost 2 years now. Of course, we know this virus will continue to mutate, continue to change as it's doing, as expected. JN.1 is, one of the mutations, and of course, this is one of the sublineages of Omicron that's taking off. The reason people are getting sick is because it evades some of the immunity that we have gotten from either vaccination or recovery from infection. And of course, when you detect it in one part of the world, because there's such tremendous human mobility right now around the world, the travel levels are back to pre-COVID levels. When you detect it in one part of the world, it's in many other parts of the world. So it's very likely to be widespread and detected in many, many parts of the world. And to your question, very important question, of course there's steps that we can do to reduce the risk of COVID-19, and it also reduces the risk of other infections transmitted primarily through the air, like respiratory syncytial virus or the flu. You can put on a mask in an indoor setting where you'll reduce the risk of infection. Obviously, we have COVID-19 vaccines that are helpful. They reduce the risk of infection a little bit, not as much as they used to, but they do a little bit. They really help reduce the risk of more severe manifestations of the virus, like hospitalization and death. And of course, we can improve the quality of the air in indoor settings to help reduce more distance spread in indoor settings.
Okay, Dr. Issac, can I ask you this then? What we are seeing, we are seeing a slight surge here in India, but 335 cases really aren't that much. Across the world, is the surge showing an increase where the world should be worried? And the new subvariant that we are talking about, is this the one that was making children sick in China? And what is the situation there?
Yeah, a couple of great questions. So yeah, this particular one, this JN.1, is growing in many parts of the world. And when we look at the case counts, it's very hard to interpret only that bit of data. I think we need to look at more holistic data, not just cases, but obviously hospitalizations, deaths, percentage of tests that are positive, wastewater surveillance. We should look at broad data to help paint the picture. But it's clear that COVID is on the rise in many parts of the world, including in many northern hemisphere locations, as is expected during the winter time in the northern hemisphere. And, of course, it's going to cause illness. And sadly, it's going to cause death. And again, we can take steps to protect ourselves and protect those around us. Now, China was, interesting because China had some, people will define this in different ways. I'm going to say pretty heavy-handed COVID control measures that were lifted later than most countries. And they saw a significant resurgence in illness in children following that. I'm in Canada right now. Canada had the same issue after we lifted our COVID measures. We had a very big year of RSV and influenza. In China, they had their officials reporting RSV, influenza, COVID, and a bacterial infection called mycoplasma as well that's known to cause pneumonias. So, it might be related to them lifting those very significant COVID measures and having a lot of people exposed to a lot of infections for the first time, which can, certainly overwhelm hospitals and healthcare systems. Obviously, it doesn't matter what part of the world people are in. We wish everyone well, and we hope to prevent these infections regardless of what part of the planet people are on.
Okay, so my last question to you is this. Would you specifically advise, given the fact that you're also a physician, would you specifically advise senior citizens here in India to mask up as well? Not just those who are unwell, but those who are well as well?
Listen, at the end of the day, in the absence of mandates, this comes down to a personal choice. And if there are mandates, there's mandates. You don't have a choice. But if there are no mandates, there are steps you can take to reduce the risk of infection. Masking is definitely one of those things that will help reduce your risk of infection. Is it perfect? Of course not. Nothing's perfect, but it certainly does help. So it's really important for people who are either at risk for infection or at risk for severe infection, like hospitalization and death, or maybe people that live with others who are at risk for severe infection, to take steps to protect themselves and so they can protect those around them. Masking is but one of several tools that we have to do this. I think one of the issues is when you have mandates, the mandates obviously need to be enforced. Otherwise, it's not really a mandate. It's just a strong suggestion. So I'm not going to pretend to know how mandates are enforced in India or other parts of the world. But, certainly you do have masks, you have vaccines, you can improve the indoor air quality. These are all steps that you can take to reduce the risk of illness. And the other thing I think I'd mention too that's very important, if people are sick, it doesn't matter if it's COVID, influenza, something else. If you're sick, you have to do your best to stay home so you don't get other people sick. Don't go visit relatives or friends and get them sick, especially if they're vulnerable to more severe illness. So I know it sounds like total common sense, but I think it's important to remind people if you're sick and you have the ability to stay home, you really should stay home so you don't get other people sick.
All right, Dr. Issac, thank you very much for joining us here on Mirror Now. Thank you very much indeed. There's a bit of a scare in India. There are 2 states in India. Thank you so much. Kerala and Karnataka that are now asking citizens to mask up. The central government has issued an advisory as well. It's a story we continue to track closely here on Mirror Now. But moving on for the moment.